Here we're going to go over this very organized Baker's cyst. This is in a 57-year-old female with, unfortunately, stage 4 cancer. She basically has this fullness and pressure and discomfort in the back of both knees, and she has these essentially non-compressible cysts with a lot of organization and scar tissue. You can appreciate that here. This is in a sagittal plane, and she was interested in essentially getting these Baker's cysts aspirated. So you can see here basically just scar tissue kind of going across the entire cyst. Here we're going to look at the same cyst in an axial plane. So you can see this, again, very organized cyst. There are some anechoic regions to it, and that actually was the focus of the aspiration. Here it looks like the lobe going underneath the medial gastrocnemius tendon is somewhat anechoic. We're putting some color Doppler on just to make sure there's no vasculature within this cyst. And here we are attempting our aspiration. We're essentially trying to get the needle in that very proximal part of the cyst, and that's where you got to be careful because the popliteal artery is just underneath that. So here we are, we're going towards that proximal anechoic region of the cyst. You can see that we're actually draining some fluid out of the cyst. Nice reverberation artifact below the needle. And here we're pulling back and trying to aspirate as we're pulling back as well, but really nothing coming out, just secondary to all the scar tissue and granulation tissue within the cyst. So if we got a little bit of fluid out, we injected with cortisone. I thought this may give her some symptomatic relief, and it turns out that she came back a couple of weeks afterwards and she got significant relief from this procedure, even though the cyst itself didn't really change much.